Hi my people, welcome back to my channel. Thank you so much for the love that you're showing me. Thank you so much for subscribing to my channel. And yeah, we are coming to the end of our series of infertility. We've talked about all those causes of infertility and how to address them. And so when it comes to a point where now someone is telling you like you've reached a point of no return, there's nothing like that, because today we are giving you like hope. There are some assisted methods of reproduction that someone can actually go through and you can be able to give birth. So due to public demand today, I have Dr. Freda once again. You people liked her so much last time and I was like, let me bring her back because what you want is what I'll give you. So Dr. Freda, welcome. You can once again introduce yourselves to people who don't know you.
Yeah. Thank you so much, Dr. Opanga, for having me once again.
Welcome.
And my name is Dr. Freda Odera. I'm an obstetrician gynecologist with a passion in women and girls' health. So today we are going to discuss assisted reproductive techniques, which are aimed at helping couples that have not been able to achieve natural conception in order for them to attain a live birth, to get a baby. Yeah.
Exactly, yeah. And we look at now the African society, whereby when you don't have a child, it's really a big issue. Like there's that, can I say it's sort of maybe a taboo or something of the sort, and many people tend to shun away or shy away from that. So what are these assisted methods of reproduction that people can actually use? You can just define and then now we'll go to the details later.
Okay. Like she has said, childlessness is really frowned upon, especially in the traditional setup, where a woman can be termed as barren, and even that can earn her being ostracized from the community or even being chased from her matrimonial home. So people try and go through a lot of lengths in trying to be able to get a baby. So assisted reproductive techniques are ways in which there is manipulation of the gametes, that is the ovum from the woman and the sperm from the man, outside the human body in order to achieve a conception. So we have different types of assisted reproductive techniques, but first we'll go through who is eligible for these techniques.
Yes.
So basically we have multiple causes of infertility that may warrant someone to go through an assisted reproductive technique. For example, if you have infertility due to tubal blockage, that is the fallopian tubes that are conduits for the ovum from the ovary into the uterus. If the tubes are blocked and assessment has been done and it has been established that they are blocked beyond repair, or the damage is so extensive that repair is unlikely to be successful, this is a person who can be eligible for assisted reproductive technique. The other reason can be due to the man. For example, if the sperm count is very low and medication, supplementation has not been able to achieve a sperm count that is compatible with a natural conception, then this person can also be eligible for assisted reproductive technique. Other reasons include advanced age in the mother. For example, if a mother is maybe more than 45 and their eggs may not be of very good quality, because you see the eggs really tend to age. Remember, the eggs in women are the ones that someone was born with. So a 45-year-old woman has a 45-year-old egg, as opposed to the sperm, which is generated every around 3 months. Every 3 months there is a new sperm. So sperms are young, but eggs are old. You're born with your absolute number until when they are exhausted. So you find that maybe a woman who has an advanced age, their eggs might not be of very good quality. They will tend to have some errors in terms of division and all. So this kind of a lady, if she still wishes to conceive, then assisted reproductive techniques can be employed on her, whereby she will get a donor egg from a younger woman, and then maybe with the sperm of her partner, and once the embryo has been formed, then it can be transplanted into her and she carries the pregnancy. Other reasons include women with chronic diseases. A woman can have a condition that may not be very conducive or may not enable her to carry a pregnancy successfully. Maybe she has a type of cancer that she's taking a lot of chemotherapy and all that. So those are people who can be successfully assisted with the reproductive techniques where her eggs can be harvested before she started on the medication, and then the eggs are fertilized outside in the lab, and then with the help of a surrogate mother, the eggs they are transplanted, and then she gets her own babies despite having a condition. Yes, so they help a lot of people in diverse settings, and therefore it is something that it is worth considering. Yes,
and I feel like not so many people know about like assisted reproductive technology and the types and everything. So we can share about that, because I feel like many people, when they reach that point, they're like, they'll start looking for maybe their partner, another woman to sire for them kids, yet they can actually go through these methods and successfully sire kids with the husband without having to bring another woman
in the picture.
Do the job for her. Yeah, it's true. It happens. Actually.
It happens. It does. Actually, that is one of the things that has been done in the traditional African society, where a woman feels she's unable to give her husband children, or she is past the reproductive age. She will find another woman who will take that role, and the children will still be considered hers in that setting. However, ART, that is assisted reproductive technology, is there to assist such women, if they can afford it, to also get babies of their own. So we have different types. One type is the IVF. It stands for in vitro fertilization. This is where a woman is given a medication to stimulate her to produce multiple ovum is the egg. Let's call it the egg. Remember, naturally we produce one egg every month because as human beings, God intended us to be getting one pregnancy, one baby. So like twins is usually an error.
Yes,
it's actually an error. You see, as human beings are supposed to get one baby for 9 months. So when you get 2 or 3 naturally, it's usually an error, mostly welcome error. So for assisted reproductive techniques, you are induced to produce multiple eggs so that the harvesting is done at once. So in that one setting, maybe we can harvest 4, 5, the number that is mature. And then while in the lab, with the help of embryologists who are specifically trained doctors and scientists to manipulate we call them the gametes outside of the body. Also your partner's sperm is harvested and then they are fertilized in the laboratory, not naturally the way it happens. And then once they are put in controlled conditions and there is development and growth, and then when the time is conducive, now they are transplanted into the body. Remember I said they fertilize multiple, so they look for the best quality ones to be transplanted. They can transplant 1 or 2 depending on the suitability of the client, and then others can be frozen for future transplantation. Yes, so that is IVF.
Then so let me just ask, is it painful to retrieve eggs from someone? Because I know for sperms it's literally not painful.
So the egg retrieval is usually done in a form of a theater, and the patient is usually under medication, so they will not feel the pain. Because you see, the eggs are not on the surface, they are inside the ovary. So there is a lot of imaging, the ultrasound to locate them, and then special equipment, and the patient is adequately prepared, and there is pain management, and it's a specific lab with qualified personnel. So it is not painful.
So there's nothing to worry about pain. You'll be taken care of well.
So that is IVF we've talked about. Then there's another one called GIFT, gift. So that is gamete intrafallopian transfer. It is a form of assisted reproductive technology in that the sperm and the ovum are still they're still what? They are still manipulated outside of the body, but then after they are ready for reimplantation, after they are ready for being taken back into the body, instead of putting them in the uterus, they are put in the fallopian tube. So the difference is just where it is put, so that it can travel naturally and fall into place like the way a normal fertilization can happen.
Takes place. Okay.
Yeah.
So this is just basically you're trying to do a fertilization outside,
And then
now you
put
take it back now to the fallopian tube,
and then it now rolls
down.
and then goes where it's supposed to be. Then there is also ICSI, ICSI, that stands for intracytoplasmic sperm injection, whereby this usually is done when you have maybe a very low sperm count, or the sperms have an abnormality in terms of movement. So you are trying to help this sperm to reach its target area so that it doesn't pass through the hard sheet. So the sperm is put inside the cytoplasm, that is inside the cell of the ovum, the egg, and then now the fertilization takes place. Then once now there is the growth of the conceptus, the embryo, it is transplanted back. So all these forms are dependent on why there is need for the ART. Depending on your specific problem, then the doctor, your fertility doctor, will decide which one you require for best results.
That is why I always tell you, don't copy what your neighbor does.
Exactly.
Because I can have now this other condition, and maybe I do IVF, and maybe you're in for ICSI. You see, there's a very different
depending on the case. Or maybe someone can go for IVF because they have issues with the tubes, which is one of the very common reasons. Another person, their tubes are perfect.
They're okay.
But maybe their husband had undergone maybe some injury to the testes, so their sperm count is very low. So their issue is more of the sperm itself. So this one is the fertilized ovum can be put in the tube because the tube has no problem, and then the tube goes and the fertilized ovum goes and implants in the uterus. So everybody is different, and each person undergoes a specific assessment to determine what will be best for them. And
earlier on you had talked about now donor eggs and donor sperm.
That's a big topic. Donor egg and donor sperm, because like I said, eggs have an expiry. Eggs age as we age. So donor eggs are usually harvested from younger women and at the facility centers, fertility centers, and there is usually a profile of the woman. So because some of our characteristics are genetic, so the woman's profile is usually taken. So age very important. Nobody wants old eggs. and then some other characteristics. So is this girl of average intelligence? Are they in college, for example? How do they look generally? If I'm trying to achieve maybe a conception and I can't use my own eggs, I will try to look for the profile of a person closest to me. So probably they have to be of African descent, because if I take Caucasian, then I'll get a 0.5 baby, and then it will be very obvious to everybody that there was something going on. Exactly. So that's why they take the profile. So even the skin complexion, the hair, the general build. For example, if I looked for 6 feet girl, and then me I'm 5'5". The height difference will be alarming. So people try to look for profiles that are closest to them, so that you make the baby be natural in terms of how they look. They don't raise a lot of questions. And then there's also good health. So there's usually questions asked on the donor in terms of if they are having any genetic condition, anything that can be passed. Because because nature is very selective, and people might not be very willing to take egg from someone who has a well-known genetic condition that they risk passing to their offspring. Like I said, for intelligence, it's obvious. Everybody wants somebody who will finish high school and somebody intelligent. And then for the sperm, we have also the donor. We have the sperm donation banks where men go to donate. For men, there is a lot of leeway because they are not limited by age. They're not limited by age. So it's basically the health condition of the person, the genetic history, and surprisingly, how many times you've donated to the sperm bank.
Oh, really?
This is very interesting because we don't want a population of
Oh,
the
many
whole
people
city belongs
looking
to
like someone, one
Mr.
person.
So and so.
Oh, yeah,
You know, Mr. So and so
okay.
can be philanthropic
Yeah.
and he wants to donate,
donate
every
and
month.
donate and donate.
And then he has a good profile. Maybe he's nice and tall, and he's handsome, and he's well educated,
Yeah.
and he's a profile that everybody might
Everybody
want.
might want.
And then you find a
Yeah.
situation where that sperm everybody
Wants
many
it.
people want to be inseminated with it, and then within no time Mr. So and so has a thousand offspring,
kids,
and then they
yeah.
don't know each other because
They
it's
don't know each
anonymous,
other. It's true.
and then you start finding people
Looking
mixing,
alike.
first of all looking alike, second mixing
mixing.
brother and sister, they don't know, they mix. So there is also a limitation as to how many times the sperm of Mr. So and so can be consumed, at least in the same area. Let him donate in Kenya and then in South Africa, so that there is a distance to prevent that, a whole city belonging to one person. Yeah.
Makes
Yes.
sense. Oh, I've learned quite a new thing. I didn't know
It's
that.
there, it's there.
Yeah,
But then
okay.
you see also, in our country, the legislation is not so
It's
clear.
not so clear,
IVF, ART is relatively new. So it was not captured in our old constitution. So the legislation is grey, it's neither here nor there.
Not there.
And that is why we have the discussion is ongoing, so that it is captured and put under our Reproductive Act.
Okay, yeah, that's good. I hope now you've learned something like me. Yeah, so
Yes.
we look at now the risks. Do this, what are the success rates, what are the failure rates, are there any risks involved with these procedures?
We will start with the risks, because they are there. And the risks that I'm talking about range from the beginning in terms of when we are preparing the lady for harvesting, up to the end where now there is the transplantation and now carrying the pregnancy. So like I said, human beings are wired to ovulate one ovum every month. Sometimes they can ovulate two at chance, but naturally it is one ovum. So when you want to harvest the egg as a scientist, you need to stimulate the lady so that she can ovulate multiple, so that when you are harvesting, because it's expensive, so when you are harvesting, you want to harvest many, so that you have a number to manipulate. In case one maybe dies off or becomes abnormal, you still have a number. So during the stimulation, a woman can get a condition known as ovarian hyperstimulation syndrome. It can happen. It's a risk, especially for the donor. So whereby you have the medication given to stimulate the ovary to produce the eggs, overstimulating. Naturally, it doesn't mean that you are given an overdose. It is just the natural reaction of the body. For some people, it can lead to hyperstimulation. So the hyperstimulation results in a number of signs and symptoms that may be fatal and can even cause death of the woman. This includes, because of the symptoms occur because of release of some chemicals from the ovary, which now act in the whole body. So the chemicals will be released in the ovary because of the stimulation, but then the chemicals because of blood supply, they act on the whole body. So the woman can develop things like fluid in the stomach, we call it ascites. The ovaries can really enlarge because of the stimulation. And then, so there is heaviness, and then the ovaries run the risk of twisting upon themselves and eventually dying. And then there is also the risk of the accumulation of fluid in the lungs, therefore compromising it's called pleural effusion, which can compromise the breathing. And then also there might be changes in the blood, whereby the blood will tend to become clotty. So the patient can get what we call DVT, and you know DVT can also cause death. And then sometimes if this condition is unchecked, there can be swelling in the lungs, fluid in the stomach. It can even go to the brain, and the patient will require ICU, and some unfortunately may die. So that is the risk involved with stimulation. And when someone goes to an accredited center, facility with people who are well trained, they are able to notice ovaries that might become hyperstimulated. So when they notice that, they abandon for the ovaries to recover. So they don't go ahead with triggering an ovary that is hyperstimulatable, because it can tip the person to hyperstimulation.
So that is not to scare you.
That is not to scare you, especially you young donor girls.
Yes,
but
don't be scared.
Have that in mind. And even when you go to a center and you want to donate, make sure you ask the fertility specialist about the risks, especially hyperstimulation, and how prepared they are to address it in case it occurs. Yes, because it is potentially life-threatening. The other risks involved include once the pregnancy has the transplantation, once they have transplanted, and maybe some overzealous fertility specialists might put more than 2. So they put 3, they put 4, you know, so that maybe you get your triplets or quadruplets, and then you close the chapter. You see, like I told you, human beings are wired to carry one pregnancy at a time. So the more the pregnancy, the more the fetuses, the more the risks involved in the pregnancy, including things like people getting hypertension in pregnancy and preeclampsia, including the
low birth weight.
Because now the babies might not reach maturity because they are squeezing, the space is small. So you have multiple babies who might not develop to full term, and then when you deliver them, they need the ICU, the NBU, the nursery, in order to achieve maturity. And then also there's the risk of miscarriage. When you get multiple, the body can reject all of them, and then you get miscarriage. And then sometimes also they can transplant only 2, and then one decides to divide, so they become 3.
So what if you have 4 and all of them divide? Imagine,
nature is interesting. So you can imagine you are carrying a pregnancy like multiple, like a small rat, and then now they have those multiple risks. So that is also a risk that you need to be aware of. And then people who have undergone IVF have to be very, very closely monitored, because it's a delicate pregnancy. So there's the expenses of antenatal care, there's that strict monitoring, because remember, they have spent money on this. It is not cheap. Some people sell property, land, you sell belongings to achieve this. So it is capital intense, and there is a lot of investment in terms of money, time, and even emotions. Yes, so somebody should be ready for this. And it's a journey you take with your partner, because you can have a lot of negative feelings, especially when the IVF does not succeed, and you've already spent the money, you've sold the property, and then now you feel like maybe the doctor did not do a good job and all that. So someone should discuss with their fertility specialist in terms of the success rates, the failure, what to expect, the complications. Do I have a second chance if the first chance fails, and all that, and the financial implication of that, so that to minimize on the resentment that can come about once an intended outcome is not achieved.
So just to give now a word of hope, I know there's someone who might be watching this and thinking, is it really worth it? Will I really be successful? So I know there's some success stories, so just a word of encouragement to people.
I would encourage anyone who is having challenges to achieve natural conception and has already been investigated, and there's little that can be done in terms of achieving a natural conception, to give IVF a try. Yes, we have success rates, we have people who have achieved the success, we also have failure rates like any other thing. Even a house can be built by very good professionals, and because of unexpected, maybe weather conditions or what, it can fail. So it doesn't mean that because you have spent a lot of money, it is a sure bet that it's going to pass. But nonetheless, that should not discourage you from giving it a try. Yes, it works. There are a lot of success stories, and it is something that anyone should consider in case they want to achieve a conception. But then again, I also want to say that someone should visit a qualified fertility specialist who is honest and who will not sell you false hopes, so that they can assess you according to your specific situation. And then if they feel like you're not a good candidate because of one reason or another, they should be frank enough to tell you, even if we do this, the chances of success are minimal. Instead of someone just doing it because you came and you have the money and this is what you want, and then they set you up for a failure. Yes.
So guys, you've heard that, and just to add on what she said, that's why I always insist, make sure whoever you're going to see, is qualified. Whoever you're going to see is actually certified to do like the procedures that you are meant to be done for. Because you never know, this field, it's full of people who are
looking out
works,
for money.
and people are just looking out for money. So make sure you really inquire and ask a lot of questions whenever you visit any doctor, whenever you want any procedure done on you. Make sure you always inquire. So I think that brings us to the end of this video, and once again I'd really like to thank Doc for the chance and just explaining this out. And Doc, once again, because people are always asking me, how do I like get Doc after we've watched a video? So you can just tell them and then we wrap it up.
Okay. Yeah. So my location will come on the description box below. I am available. Can call, text, WhatsApp, and schedule an appointment, and I shall be able to guide you further on what you require. Yes, and then also to add on to the message of hope, we have many more fertility centers that have come about. So someone can just seek to get information from one center. You can also try and maybe compare with another center in terms of the price, in terms of the indication for the treatment, so that once, because it's finance intense, it's something you're going to spend your money on. So you want to be sure what you're getting yourself into and your chances of succeeding. So you can compare, ask, inquire, get the quotation, have the planning done, and then we wish you all the best in your journey to having a baby. Thank you
so much. And guys, please make sure you subscribe. We are growing, so make sure you share with your other people, share with your friends, even if you have enemies. Share with them so that they can also learn.
They can learn and get to be helped with the information.
Because I've realized so many people are suffering in silence and they don't know where to get this info. So if you like this video, please give it a thumbs up, subscribe, and let us meet in the next video. Thank you and bye.